Hello, my name is Lisette Irarrazabal. I'm a teacher from the School of Nursing here in Chile. I'm also assistant professor from the School of Nursing and Health Studies in Miami. So that's why I'm being invited to share with you our health system. I'm very pleased to do so. Just tell you a little briefly about me. I'm a nurse and a midwife as a background. I was able to do my master program here in Chile and also my PhD study in Chicago at the School of Public Health. Well, with that little background, I'm able to start my presentation. I'm more than happy to be able to tell you about our system, but before I need to also show you some of our health indicators. Chile is a long and narrow country stretching along South America's western edge, with more than 6,000 kilometers of Pacific Ocean coastline. Santiago is the capital of Chile. This country sits in a valley surrounded by the Andes and Chilean Coast Range mountains, driven by a broad diversity of products and industries. The Chilean economy stands on the sturdy pillars of mining and agriculture, but it's also rapidly drawn creative and entrepreneurially force from around the world, developing its tech, film, and biochemical industries as well. Our country speaks Spanish and also other native languages like Mapuche, Mapudungun, Quechua, and Rapa Nui. Our gross domestic product is $247 billion. Our GDP per capita is around 15,000 US dollars. If we compare that with the United States GDP, it's much lower because the United States has a GDP of $52,000. Our unemployment rate is around 6.9%. Again, if we compare it with US unemployment rate, it has 4.3%. So our Chilean unemployment rate is higher. We have 11.7% of the population in a poverty condition. In this slide, we can see different aspects like life expectancy, education, GNI per capita, and HDI. Let's go one by one. As we can see here, the life expectancy table is the blue one. Currently, around 2015, it's more than 0.95. The education level, it's increasing to 0.78. Our GNI per capita is around 0.81, 82, and our HDI is clearly around 83, 84. I'm going to explain each one of their concepts that are in health indicators. I mentioned HDI. This is the Human Development Index. The Human Development Index is a comparative measure of life expectancy, literacy, education, and standards of living for countries worldwide. As we see the pictures here, we can observe different colors. The more dark green it is, the higher HDI it has, closer to 1, which is better. Chile is a light green color. Let's see next one. This is another slide that is showing us our reality regarding immigration, which impacts directly to our health system. Chile is the Latin American country where immigration has increased the most, around 27% in the last 7 years. This migratory flow is mainly labor motivated. We have mainly a border country immigration, even though there has been growing increase from countries with which Chile has not continuity, such as Colombia and Ecuador. But furthermore, we have also immigrations from Haiti, República Dominicana, Cuba, Mexico. I think this slide can better show you from the different countries we have immigrants from. And the colors represent, you darker the color, you more percentage or amount of immigrants coming to our country. Well, here we can see some other general aspects. Chile spent in health expenses $8.64 per person. The total health expenses from the GDP was 7.8%. It has been less, around 1.5 percentage points below the average of the OECD countries, who spends around 9.5% in health expenses from their GDP. If we look at the women and men ratio, that is 94.67, which means that it's 94.65 men per 100 women. Our life expectancy is around 82 years old. Compared to US, it's higher, who has a 78 years old life expectancy. Of this slide, I would like to highlight our fertility rate. Our fertility rate is 1.75 births per woman. This is a decrease of fertility birth since 62, which we had around 3.75. This is also showing an accelerating aging process, which is a concern that the Chilean health system is facing, since it's having an older population and with more chronic conditions. That is also increasing among young groups. With this slide, I'm showing how the tendency of aging population is working in Chile. As shown in the pictures, we can see that currently we have a pyramid that doesn't look like a pyramid anymore. It's pretty much almost as many new births as we have old people. In this slide, I wanted to share with you so you can compare our main death causes. We can start with the biggest group, that is 27.5% shown among cardiovascular diseases, followed by tumors, malignant or cancer tumors, respiratory system, external causes, digestive system, endocrine system, and so forth. In this slide, we can see our resources in health. I would like to share with you principle 2 of interest: medical resource and nursing resources. If we compare these resources with other countries around the world, and highlighting the OECD countries, which has 3.2 physicians per 1,000 inhabitants, Chile has 1.7 physicians by 1,000 inhabitants. If we compare nurses with the OECD countries, it has 8.8 nurses per 1,000 inhabitants, and we have 4.4, much lower. Our healthcare system is aiming towards increase the level of health among the Chileans, to improve equity in access, improve the technical quality and perceived quality of the healthcare actions, increase efficiency of the system, and ensuring sustainable funding. Chilean healthcare has a mixed method. It's divided between public system and private system. At the public system we have FONASA, and the private system we have ISAPRES. If we look more in details, we can see that around 12.7 million of Chileans are part of FONASA, and 2.8 million are part of ISAPRES, and 1.6 million are part of other types of insurance. FONASA has 4 categories: A, B, C, and D. Let's look into them. According to the category you are in FONASA, you are able to get a free attention with no cost in health, or have some co-payments. You higher your income is, you higher letter you will receive, or let's say a C or a D letter, as shown. The next slide is showing different ISAPRES. All this is the private sector that a person can choose between. Each ISAPRE offers different health care plans. The difference between FONASA and ISAPRE is that FONASA doesn't require any more co-payment or payment for each plan if you have 2, 3, 4, or 5 children. Compared to ISAPRES, if you have 1 child, it will cost you more. If you have 2 children, more, and so forth. This is our new healthcare system. We went through a health reform in 2004, so I'm going to highlight the new one, the new health reform. Entering into the new health reform 2004, the Ministry of Health was transformed into the fundamental pillars of a new Chilean health system, seeking to provide better health and a greater coverage to the population, guaranteeing the access to right, equality, opportunity, and then finance of health problems that are included in the GS regimen. GS represents the Garantías Explícitas en Salud, the new health reform. MinSal, the one at the top, is the National Sanitary Authority, including functions. It includes functions related to the formulation, fixation, control of health policies, establishing norms, evaluating and controlling the organization of the healthcare of the entire population. The Ministerio de Salud is then divided in two. La Secretaría de Redes Asistenciales, this one, it regulates and watches over the functioning and development of healthcare system network for the holistic integration of people and the regulation of the service, such as rules designed to define levels of care necessary for different types of benefits and the quality standards that will be required. To achieve this objective, it will develop policies, standards, plans, and programs, and coordinate their execution by health service. The next is the Subsecretaría de Salud Pública, is the health authority responsible for promoting the health, surveillance, prevention, and control of diseases affecting population or groups of people. To do this, it will coordinate the actions of FONASA and the Institute of Public Health and instruct them. In the monitoring role are Instituto de Salud Pública, ISP. As its main function, it has to control regulations, health surveillance, and dissemination of public health, matters mainly in the field of laboratories and medicine, guaranteeing the quality of goods and service. This is allowed contributing to the improvement of the population health. Thus, the ISP carries out work in various areas of health, such as laboratory quality assessment, disease surveillance, drug control, and controlling cosmetics and devices for medical use, environmental health, occupational health, production, and quality controls of vaccines, among others. La Superintendencia de Salud is a public body. The Superintendencia plays a controlling role within the health system, compliance with FONASA and ISAPRES regulations according to the institutional modality of free care, as well as public and private providers in terms of accreditation and certification. Then we have Secretaría Regional Ministerial. They are in charge of exercising the functions of the Subsecretaría de Salud Pública at the regional level. Therefore, they perform regulatory and health inspections in the health service and healthcare network. We continue with the role of service provider. Public and private health provider. Here. FONASA is a public service, functionally decentralized, endowed with legal personality and owned property, dependent of MinSal. The private health subsystem was created in 1981 and is managed by the ISAPRES. Their beneficiaries correspond to workers who have freely chosen the private system which provides benefit according to the different plans and coverage that are offered. Since 2005, both FONASA and ISAPRE are supervised and controlled by the Superintendencia de Salud. And Servicio de Salud are a functionally decentralized state body, endowed with legal personality and own property for the fulfillment of its purpose. They are in charge of the articulation, management, development of the corresponding healthcare network, implementing of integrated actions of the promotion, protection, and recovery of health, as well as the rehabilitation and palliative care of sick people. This part. Servicio de Salud. Well, I have reached the end of my presentation. I hope I didn't left you with too many questions. This will be a challenge for your teacher to answer those if you have some. Or you can always write to me and I will be more than happy to answer some of them. Just a brief, very brief summary. I think one of the biggest challenges we have currently in our country is related to two main topics. After the description of our epidemiology and our tendency in immigration, I think we need to work hard on reviewing how we can include and provide with access and quality in health to those immigrants that have not been able to know more about our health system and not been able to have documents and be in a legal situation in our country, or irregularly documents, so they have no identification number equivalent to your identification number, right? And so without that number, we almost don't exist. So it's important to work on how we can provide with what is right and what is their right to access health when they need it. Another important challenge is related to our chronic conditions. Since we have more and more older people, we have also an increased amount of people with chronic diseases. But unfortunately also, and something to think about, that more younger groups have been developing chronic diseases. And this is also in hand with our new lifestyles. So concern about how to actually help our people to get healthier habits and to prevent chronic diseases had turned to be not only a fight from Chile, it's a national and international fight. How can we approach our patients in a way that they can better make conscious of the importance of be adherent to the treatment or choose a healthier lifestyle, like leaving the car at home and walk, or take public transportation. Decide every day to do an exercise instead of sitting and watching TV. It's a big goal. Well, why not recognize that we, even us who are healthcare providers, are also fighting with having a healthier lifestyle, even though that we know and have the knowledge that we should do, we have serious difficulties. So I believe this is a challenge not only for our countries, as I said before, but our focus have been to implement a model centered in people, a modelo centrado en la persona. So we are training and forming our students, undergraduate students, in focusing on using this model. Well, thank you again for paying attention, and I hope you have a broader picture about our Chilean healthcare system. Bye.